Hey guys, it's Eden. Welcome back to my channel. Today I'm finally coming back at you guys with the breast augmentation video that I've been promising you guys for months, like literally since even before I got the breast augmentation, the surgery. Sorry for lagging it. I'm just a procrastinator, and then it's only been like 3 months since I've had my surgery, and it was a process. Like, it really took a toll on me and my mental health and like my body. So I didn't really have the energy to film anything. I just was exhausted, mentally, physically, all that. But anyway, so I'm gonna be covering my breast size or my implant size, what kind of implant I got, saline or silicone, who my doctor was, where my surgery was, when my surgery was. Basically, I asked you guys to drop any questions on my Instagram and like ask me what you would want to know about my breast augmentation surgery, and you guys basically asked about all of it. So I'm going to be covering every single one of your questions. Some of them were repeated, but trust me, it's all going to be covered in this video. By the way, if you're new to my channel, again, my name is Edenrodriguezz. I'm 22 years old. I'm a woman of trans experience. If you'd like to see more of me, go ahead and subscribe. Turn on those post notifications for the rare occasion of when I actually post. It's not that often. My last video was like maybe 4 months ago, but I promise I'm gonna work on it. Like, I'm gonna try my best to be a good content creator. But yeah, without any further ado, let's get straight to the video. Okay, so the first thing I want to talk about is why I got this surgery. So basically, I got my breast augmentation surgery because, as I said before, I am transgender, and being that I didn't have like enough breast growth like that I wanted, because when you're trans, you obviously take hormone replacement therapy. And for me, a male to female trans woman, I was on estrogen for, I want to say like a good year before I actually scheduled my breast augmentation consultation, which basically a consultation is like when you meet with the surgeon and you tell him like what you want, and you like feel him out, see if like you're interested in the type of work that he does. And then you guys end up scheduling a date if you do want to go forward with him and with the surgery. So the requirements for a trans woman, if you're going through insurance, which by the way, insurance paid 100% of my surgery, taking full advantage of the government. But yeah, basically a requirement is that you are on estrogen for at least 1 year. And like I said, I was already like a year and a few months on E. So the process in getting approval for my surgery from my doctor and my insurance was pretty quick. I just had to like get my therapist and my provider to sign off and give me the like green light that I was okay to like get the surgery. But yeah, my point is I didn't actually have enough breast tissue. I had like maybe a very small A, like you could see like some mass there, like, if you know what I mean. And like when I wore a bra, you can kind of see like a small A cup, but it was just like not it. It was like, I don't know, I was just like really flat chested. And I might have gotten a little bit more breast growth if I waited like another year or two, but at the rate that I was already growing breast, I don't think I was gonna reach like what I wanted. I don't even think I would have reached the B cup. And I've always had like the goal of like having like D size breasts, because I do have like larger shoulders, at least for like a girl. I feel like I do. Like I have wider shoulders, and like my chest and like my body size is just like wider as it is. And I also have a like pretty decent like butt. Like my butt is like a little juicy, if you know what I mean. So yeah, I really just wanted to like level out my body and like match my breast to my butt. And another very important reason of why I got the surgery is because for a lot of trans women, getting surgeries like your breast done or like any other surgery are really affirming to like your gender. It makes you feel like more comfortable in your own skin and more comfortable in your identity as a woman. It just makes you feel like, or for me personally, it makes me feel a little more confident in my femininity. So yeah, that was really important for me in my identity. But I just want to note that like, you don't have to have boobs, you don't have to have a big butt, you don't even have to have a vagina or anything like that. You don't have to go through surgeries, whether you're trans or you're cisgender. None of that makes you a woman. As long as you identify as a woman and you feel like you're a woman, then you are a woman, and no one can take that from you. And be reminded that women come in all different shapes and sizes, and we're all beautiful. Okay, so next I want to talk about how I chose my doctor and who my doctor was. So again, as I said before, in order for me to get my surgery 100% free, I had to go through my insurance and my doctor, my clinic, my like main provider. So at my clinic, they specialize in like trans health and trans care, and they have like a whole little like trans advocacy team that helps you out, like just a bunch of other trans people and trans women that help you out in figuring out like which doctors are offered by your insurance and like who they know have gone to and like what they've heard, like reviews about those doctors. So basically one of the advocates there, her name is Jennifer. Actually she has the same last name as me. Her name is Jennifer Rodriguez. She's like an angel. I love her so much. She's really helped me throughout my transition because she's the one who recommended Dr. Alexander Sinclair to me. And she also helped me like get like approved for electrolysis, which is like permanent hair removal. So she told me that my doctor is Alexander Sinclair, by the way, from Beverly Hills. He has an office in Beverly Hills and an office in Whittier. But yeah, so basically she told me that a lot of the girls that go to the clinic that I go to and a lot of her like personal friends and colleagues have gone to Alexander Sinclair, and that he does really good work, and like he's just really good at boobs. He's really good at doing boobs. So yeah, since I trust her, I was like, okay, let me just look at his work. I went onto his profile or to his website first before any other surgeon, which actually I'm not even gonna cap. Like I only looked at his website because I mean, Jennifer said he was good. So like he was good, you know? So yeah, I just looked at his work and like I really like the results on his website. And so yeah, that's basically how I made my decision on my doctor. And I just followed up with my insurance, and they're the ones who mediated like setting up a consultation with him. Okay, so for my breast implant size, I got originally I was supposed to get 600 cc's of saline, but what ended up happening like last minute, like 6 months later, when I was actually gonna get the surgery, I ended up deciding like the day before surgery that I actually wanted to get silicone. And because it was such short notice, the day of my surgery, my surgeon, Dr. Alexander Sinclair, he brought two options for me. He brought a 520cc and a 580cc because like that's all he was able to like get like the day before. So yeah, I ended up going with the 580cc silicone implants, smooth silicone, which actually apparently the FDA doesn't allow people to get like rough or textured implants anymore, but that's just what my surgeon's secretary told me. I'm not sure if that's 100% true. So the reason I ended up picking silicone over saline is because I watched a lot of YouTube videos on both, and I kind of like weighed the pros and cons of each implant. And so basically, personally, I felt like the saline, I wasn't really gonna like it because I saw on a lot of like YouTube reviews of like, or YouTube videos of girls who had gotten saline, and like ones who didn't have like a lot of breast tissue to begin with, and they ended up getting like big sizes just like me. And what ended up happening to a lot of them is like you could see the rippling like on the side of the boob from the implant, because the implant's like the way that it's set up, it's like basically a bag made of silicone filled with water, and the way that water, like the natural properties of water, like inside the bag, like it just makes it like ripple. And so I really didn't want that. And I heard too that it's more of like a fake look, which is like, if that's what if you want like a very exaggerated look and stuff, I'm all for it. Like, power to you. But personally, I wanted something that was a little softer to the touch, because apparently silicone is a little bit more natural feeling than the saline, and I really didn't want the rippling to be showing through. And I chose my size because, as I said, I did want to have like at least a D. And my doctor, when he like measured my chest and everything to like choose like the size of implant that would go best with my chest and my body and like my shoulder length, he told me that 600 cc's would be best. But as I said, last minute, like, I changed my mind, and the only option available was 580 cc's, which sounds like it's really big as it is, but keep in mind, I didn't really have a lot of breast tissue to begin with. So most girls that have like at least like a normal size A or B get anywhere from like 300 to like the most like 400 cc's, because they don't really need that much more of a lift because they already have that breast tissue there. But yeah, that's basically how I chose my implant size and my implant type. Also, another important detail about my boobs, my breasts, is the incision type, which is basically like where you get your incision and where they place your implant, which I had my implants placed under the muscle with an inframammary incision, which is basically just like right on the breast fold under your boob, or your boobies, I should say. And I don't really know why my surgeon decided to put it there. He just told me that I wasn't a candidate for like under the armpit or the navel or anything like that. And I think it's because of the size of the implant that I was getting, because like it's a pretty big implant, 580 cc's. And to put it through the armpit, I don't think was an option. And I also personally didn't want my incision through the areolas, because I like having sensation there. It's very important when I'm intimate for me. And I also didn't really want like a super noticeable scar, because when it is under the breast fold or the under boob or whatever, it is more hidden, because once your boobs like start to lower, they end up hiding the incision, which I can show you guys the incision really quickly. So yeah, that's the incision. It honestly doesn't look too bad. Personally, it doesn't really bother me the way it looks. It's not bumpy or anything. It's not raised. It's just still a little red. But with time and after I start applying scar cream, because my doctor did tell me I can start applying scar cream to it since it's been 3 months, it'll start fading away. But I'm really not like insecure or worried about it, because like I said, it is hidden like right under the boob. You can't even see it. Okay, so next let's talk about what I had to do to prepare for the surgery. So since I am on hormone replacement therapy and I take estrogen, my chances of like getting a blood clot and like a heart attack and stuff like that, or a stroke or whatever, are a lot higher than a cisgender woman. But even then, the risk is like relatively low. Like, it's not that big of a risk. It's just a possible side effect. So in order to prevent anything bad from happening during surgery, the surgeon, Dr. Alexander Sinclair, he had me stop hormone replacement therapy for at least 2 weeks. So I couldn't take any estrogen or testosterone blockers, which is pretty standard for like most trans surgeries in general. Like if you're female to male, if you're male to female. Although I have heard that other surgeons like usually require patients to stop hormone replacement for at least 1 month. But again, it varies like from doctor to doctor. Also, 2 weeks before surgery, I did have my pre-op consultation with a doctor, and we basically just went over what implant size I was gonna get again, just to make sure that I hadn't changed my mind or anything, which like I said, I did end up changing my mind later. But yeah, and then he sent me home with like a prescription for antibiotics and painkillers for after the surgery that I had to actually fill out before I got the surgery. That way I could have them ready right when I got out. And I just personally felt like I wanted to do my best, like eat healthier and like exercise every day before I had a surgery, just so that I can make sure like I had the best outcome and no complications. But honestly, just follow anything your doctor says. I know like when you're gonna get the surgery, you're looking through all kinds of stuff on YouTube, and a lot of people recommend like different type of things and what to do. But your surgeon is always gonna know best. He or she has done this like many times. At least I hope so. I hope it's not their first time, and I hope that they're certified. But yeah, just trust in your surgeon. This video is honestly already getting way too long for me. So I think I'm just gonna make a part 2 about the recovery and what it was like on my body, like the physical part and the mental health part, because oh my gosh, I broke down so many times. I had so many anxiety attacks. Ugh, like I don't even want to remember it. I don't even want to go back to it, like ugh. But yeah, if you like this video and you want to know how my recovery went, please go ahead and like, comment, and subscribe, and make sure to turn on the post notifications so you can get notified when I do post the part 2 of this video. Also, if there's anything that I didn't cover on or touch on, or any questions that I might have missed, please go ahead and leave them down in the comment section below. And also let me know what other kinds of videos you want me to do in the future. But yeah, that's all for this video. Breast augmentation surgery part 1. Can you guys believe I finally recorded the video and put it out? I can't believe it. Like I literally took months to do it, and I kept saying, oh, I'm gonna do it this day and I'm gonna do it that day. It's been so many months later. Sorry for trolling you guys and promising you guys a video that came out so fucking late. But yeah, that's all for this video, guys. Wishing you all peace, success, and happiness. And don't forget, you are that bitch.